Hi, I'm Dr. Julie Boll. I'm a vascular surgeon with the surgical clinic here in Nashville. I originally got started in vascular surgery during my general surgery training in Chicago at Cook County Hospital, where we saw the whole gamut of vascular surgery: veins, arteries, wounds. And what most interested me about it was that we're essentially the primary care physicians of the surgery realm, because our patients keep coming back to see us, they keep getting new problems, and it gives me a great way to build relationships with my patients and have some continuity with them. For me, in my career span, we've kind of already been in the more technological age of taking care of venous disease. So when I was trained in fellowship, I was trained to use things like the laser, foam therapy, sclerotherapy, things like that, as opposed to back when we used to do more open, much more invasive surgery, like having to strip out the whole vein, as opposed to being able to do things from minimally invasive techniques just through a little poke hole. For the most part, I treat patients with superficial reflux. So there are two systems of veins in the leg, a deep system and a superficial system. Most patients that present with leg swelling, varicose veins, have a problem with the superficial system that's relatively easy to treat with outpatient surgery. As a board-certified vascular surgeon, I see people with vein disease that runs all the way from very superficial, almost just cosmetic issues, all the way to patients that have clots running all the way up and down their leg, up into their abdomen. And so being able to more appropriately pinpoint where in the spectrum that patient's venous disease lies, you're better able to target a therapy towards them that, again, is ultimately going to end up with the best result. I obviously think it's beneficial to see a vascular surgeon for vein problems. We're kind of the original gateway keepers for veins, especially because if it's a vein problem that isn't properly worked up and a procedure is done, it could actually potentially make the vein problem worse. So, in terms of patients, that sometimes we recommend medical treatment and just compression socks, because we know that if we operate on you, we could potentially make you worse, versus by having us see you, we know the difference between patients that would benefit from surgery and those that wouldn't. So outside of the hospital, one of my main hobbies is running. I'm a marathon runner, usually try and run 2 or 3 a year. So a lot of time outside the hospital is spent doing that. But I also have a husky, and so he goes out on runs with me. He can usually make it about 8 to 10 miles before I have to send him home. And then I also like going back to Chicago to spend time with my family.